Hi there, this is Dr. Paul and thank you so much for tuning into this video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about your replacement options for single and multiple missing teeth. Now, if you're one of those people who have good oral hygiene, have all your teeth, and you don't really need a replacement, nothing to see here, you can kind of move along. But if you're one of those people who are unfortunate to have a missing tooth or a couple of missing teeth, you might want to stay tuned for the information that I'm about to give you. Now, when you look back at it, your natural tooth is probably the best biological entity in your jawbone to handle day-to-day stresses like clenching, grinding, chewing, enjoy your food, which means your teeth can transfer to your brain the kind of textures that you're chewing on because your tooth has a neuromusculature bundle attached to the periodontal ligament, which is this little thin membrane that's around your root of your tooth. And also this membrane is the reason why orthodontists can move your tooth around and straighten them if they come in crooked. Now, that being said, when we talk about replacement options, we have a couple of replacement options, and we kind of broadly divide them or categorize them into removable and fixed. Now, removable are areas or prostheses that you can take out and put back on by yourself, which means you can take it out, clean it, and put it back on. And fixed, of course, like the word mentions, it's something that only a dentist or someone in dental can install and take out. Now, that being said, removable can have multiple options like a removable partial denture, a flipper, which is the most preliminary removable partial denture, and then you have a cast partial denture, which is a little bit more fixed. It consists of acrylic, which is plastic, and also metal, which can clamp and hold on to parts of your teeth, which also has a few more components like your major connector, your minor connector, your retentive terminal tips, and of course your guide planes. Now, these are all a little more complicated, but in the photos that's on the background, you can actually see what I'm talking about. Also with removable, you have complete dentures. So when someone doesn't have all their teeth, they get an upper or lower complete denture, or actually an upper and a lower complete denture. And this is made of acrylic and also fake teeth, which is pretty much acrylic as well, but a different texture and a different shade. With removable, you also have implant supported over dentures. So you have implants that are placed in the jawbone, but you have dentures which can be clipped in and clipped out. Now moving along to fixed. With fixed, you have bridges, which is when you shave the tooth in front, the tooth behind, and then you put on this prosthesis, which is cemented on by the dentist. And you have implants. So an implant can be a single or multiple, and implants can be screw retained, which means the crown over the implant is screwed onto the implant, and you have cement retained, which is the crown over the implant is cement retained over the implant. The advantage of a screw retained is if you have a small jaw or a small amount of space, a screw retained prosthesis can be inserted permanently. Cement retained needs a little more, which is around 8 millimeters. So that's the difference of screw retained and screw retained versus cement retained. Now, what it all boils down to is what kind of edentulous span or missing teeth situation you have. So dentists categorize this as class 1, which is where you have both sides of your back teeth missing. And by that, what I mean is you have no other teeth behind the missing span of teeth. So that's the class 1 classification. Then you have class 2, where in both sides of your, single side of your jaw, the tooth behind the back of the missing span, it doesn't exist, which means you have the distal terminal, which is pretty much soft tissue. Then you have class 3. Now, class 3 basically means you have a single tooth or a bunch of teeth missing, but you do have a very back tooth that exists. And class 4, which is predominantly where one or more of your front teeth, and how we define front teeth is from your canine to your canine, or your eye tooth to your eye tooth missing. So this is how we classify missing spans or edentulous spans. So when you have a situation like this, you need 4 properties for anything that you're trying to restore as far as teeth or fake teeth go. So you need to have support. So imagine support as the vertical force that the prosthesis needs to avoid. So a classic example is you have a chair. Support basically means when you sit on the chair shouldn't break or collapse. Then you have resistance, and resistance basically means that forces that are not vertical need to be handled by the prosthesis and the teeth, so that the fake prosthesis doesn't come out of your mouth when there is an off-angle force. Now then there is retention. So imagine support, but exactly the opposite. So say there you have a chair, someone is sitting on the chair needs to have enough support to hold the load, and say this person is trying to get out of the chair, but the chair for whatever reason is stuck to this person. The chair needs to have enforcing forces to keep the chair plugged to the ground. So think of support and retention as completely opposite of each other. And finally, you have stability. So stability basically means off-angle forces more in a torque or rotational aspect has to be handled by the teeth and the prosthesis. So once you understand retention, resistance, support, and stability, now you transfer the same principles to one single or multiple missing teeth. And this is where it gets kind of tricky. So let's talk about the first option or the first situation, which is where you're missing one tooth. Now, when you miss one tooth, you need to gauge for restorability space, which means if you miss that tooth, do you have enough space to compensate that tooth? And when we mean restorability space, we're not talking about the root part, we're talking about the crown part. So do you have enough space to restore a crown for that missing space? So what that means is, say a tooth is pulled out, you have teeth in front or behind the missing space that has collapsed into that area, or the tooth right over on the opposing arch that's collapsed into the area. Now you have missing restorative space. Now, when you have missing restorative space, it's not a very difficult fix. We need to think about orthodontics, which is where the space is regained by moving those other teeth which are not supposed to be there orthodontically, or we can compensate by using a smaller restoration or a smaller crown. So restorability space is something that we need to assess right from the get-go. So a few things to think about when you have a situation where you have compromised restoration spaces and the patient doesn't want to have orthodontic treatment. Then we go ahead with something called a screw retained restoration, which is where you have the crown part that is screwed on to, say, for example, an implant or two implants. So it's always a game where we need to figure out what the restorability space is, because at the end of the day, if you have enough space to put an implant, but the implant can't be loaded or can't be made functional, the whole exercise is kind of pointless. So that's a very, very important factor. Now we talk about having enough of bone width to handle whether it be a bridge, a partial denture, or an implant. So it's a little more important to have that bone width in the case of an implant, because an implant, when you think about it, is a titanium screw that's lodged into your jawbone. So when an implant is lodged into the jawbone, it needs to have enough of bone housing around the implant. So what we kind of go over from a lot of studies done by very, very smart people in the field is you need to have at least 1.5 millimeter of jawbone around the implant towards a neighboring tooth. 3 millimeters between an implant and an implant, but usually 1.5 millimeters between an implant and adjacent teeth. Now, you need to have 1.5 to 1.8 millimeters of jawbone between the implant and the side of the tooth or the side of the bone towards the cheek and the tongue. Now, all this is super important because when you have jawbone around an implant, you have soft tissue or gum that stays around the implant. And when you don't have enough of jawbone, the bone resorbs because of lack of blood supply, and then you have the gum recession that occurs. And in addition to all this, the threads of the implant get exposed. And once the threads of the implants get exposed, it's just a matter of time till the entire implant fails. So unlike a natural tooth, an implant doesn't hurt when it's failing, but just like a natural tooth, once you have gum and bone loss, especially around an implant, because the gum around the implant doesn't have certain kinds of fibers that ward off the bacteria from burrowing quicker and deeper. So this is very, very important because sometimes when an implant is placed and not placed very well angulation wise or not placed into a good housing of bone, the implant will slowly but surely fail. it just takes a long time, and it doesn't or it might not hurt as much, but eventually this implant is doomed to fail. So hopefully I haven't confused you too much, and these photos should help you. Now let's talk about a bridge, which is a substitute for an implant, where we use the bridge when we have a tooth in front and a tooth behind the missing space that are equally filled, or for this matter not really filled, which means a virgin tooth. So right off the bat, whenever we have virgin teeth, we usually don't recommend bridges because an implant saves those virgin teeth from being shaved down. But when you have heavily restored and compromised teeth around the missing space, it's less expensive and more logical to go with a bridge. Implants and bridges both are artificial prostheses and come along with their own pros and cons, but at the end of the day, it all boils down to not doing more damage to the area by thinking about things smartly. So in the next couple of videos, I will go over implants more in detail and also with bridges, and then of course we will talk about your other options. Thanks for watching.